Tonight, the death toll in the U.S. rising to more than 12,000. In New York, the worst day yet. One person dying every 2 minutes. The Navy hospital ship the Comfort beginning to treat coronavirus patients, but a crew member testing positive. The new warnings why people of color may be especially at risk. And the new side of hope, what New York's governor says is happening in the state's hospitals. Also tonight, the primary in a pandemic. Long lines at the polls in Wisconsin. The state going ahead with the election after a fierce battle over whether to postpone. The dramatic shakeup, the acting Secretary of the Navy resigning after he fired the captain who sounded the alarm about an outbreak on a U.S. warship. Where is the relief? Hundreds of thousands applying for the federal government's small business rescue program. Why have so few gotten money? Our NBC News exclusive, Senator Amy Klobuchar and her husband, their first joint interview since his battle with coronavirus. It all began, they say, with a fever.
I kept saying, it's over 100, like every day. It's still over 100. I think you might have this.
Their new message tonight to families and the race to ramp up the new testing that officials say may be the key to getting Americans back to work.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. Tonight we are struggling to isolate the hope somewhere inside this horror, but it's hard to get past the numbers like we saw reported in New York State today, recording its highest single-day death toll from COVID-19, 731. But even as this virus kills and sickens in communities across this country, there are slowly emerging signs of encouragement in places that some of what we're doing may be working. Let's turn to our team on the front lines now, starting with Gabe Gutierrez.
With New York hospitals pushed to the brink, the state's coronavirus death toll had its largest single-day spike yet. 731 people died in just 24 hours, one about every 2 minutes.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
But there's some encouraging news. Governor Andrew Cuomo is now projecting that New York is reaching a plateau. The average number of hospitalizations is going down.
The 3-day average is down, which is good news.
Still, aerial images from New York City show not everyone is properly social distancing.
We must continue those strategies if we're going to protect lives.
So far, only about 50 patients have been treated on the U.S. naval ship Comfort. A crew member there has just been isolated after testing positive for the virus. Now, one of the largest churches in the world, the Cathedral of St. John the Divine in Manhattan, will turn into another field hospital to relieve the pressure on doctors like Nicholas Hernandez at Northwell Plainview Hospital.
We're pretty much putting out fires wherever we can.
Weeks ago, he himself got sick.
You know, I worried about my family. I have an 8-month-old. I had to, be careful with, and tried my best to do everything I could to maintain my distance. But it's still that worry. Am I going to make it through this? Are my symptoms going to get better? Why am I not getting better? It's day 10, it's day 11, it's day 12.
He's now back at work for grueling 90-hour shifts. But over the weekend, his grandfather came into his ICU. He's now on a ventilator.
This virus doesn't discriminate.
For so many on the front lines, it's the battle of their lives.
I felt just defeated, unappreciated.
We first spoke with New York ER doctor Sion Faroux last week. Days later, she started showing symptoms. She's now staying home, frustrated that it was so hard to get a test.
When seeing asymptomatic White House officials and celebrities, animals at the zoo, getting tested was very frustrating, anger-inducing, and felt worthless.
Among the lives lost, Raymond Copeland, a New York City sanitation worker. Deputy Chief Inspector Syed Rahman was a 22-year veteran of the New York Fire Department who helped clean up Ground Zero after 9/11. He leaves behind a wife and 4 young sons. Pastor Isaac Graham had led the congregation at Macedonia Baptist Church of Harlem for more than 40 years.
He never, ever let no one forget that his family came first after God. And again, I thank God for his life.
State authorities are hopeful New York may be turning a corner, but for the families losing loved ones tonight, it is no less painful. Lester.
Yeah, Gabe, thank you. There are troubling signs as the virus spreads to other hotspots across the country, with new data suggesting communities of color are hit much harder than others. Here's Miguel Almaguer.
As the coronavirus spreads across big cities and small communities, it took roughly a month for our national death toll to reach 5,000. But in less than 5 days, that number doubled, now surpassing 10,000. It comes amid scenes like these today in Florida. Little social distancing as many wait in line to file for unemployment benefits. In Wisconsin today, a primary election unlike any other.
I haven't seen anything like this in my lifetime.
Thousands of voters battling long lines and masks, trying to stay 6 feet apart after the courts blocked an effort to postpone the election.
They should have prolonged it or pushed it back.
Frustration in Wisconsin comes while Michigan is now experiencing their deadliest days. More than 700 employees at the Henry Ford Health System in Detroit have contracted the virus, the police chief among the nearly 600 officers spending time in quarantine.
I've never seen anything like this. You know, I've been through earthquakes and riots in Los Angeles, so I know what a significant crisis looks like, but not like this.
Though no community is immune from the virus, people of color are facing alarming rates of infection. In Chicago, 68% of the city's deaths involve African Americans, who make up just 30% of the population.
Those numbers take your breath away.
In Louisiana, 70% of those who have died are also African American, though they too comprise roughly 30% of the state's population. Dr. Uche Blackstock is on the front lines of the fight.
COVID-19 is the perfect storm for our Black and Brown communities, which are mostly low income. You know, they're going to be the most affected due to lack of access to testing. Many of them still working on the front lines as essential workers or service workers.
Tonight, several states have not issued stay-at-home orders, even as new infections and deaths mount. In Seattle, we are getting an exclusive look inside the University of Washington's COVID unit, where the most serious cases get critical treatment.
We just cannot take our foot off the gas at this point. We need all the capacity that we can manage to be able to care for a potential second wave of COVID patients.
In states like Washington and California, where social distancing measures were ordered early, the Surgeon General says the infection curve there has flattened. But hospitals across the country are still bracing for patients like Paul Logan, the Indiana high school athletic director who has been on a ventilator for 6 days.
They don't know what's going to happen next. Like, they're just as blind in that field as we are. And so they do say prepare for the worst, but they hope for the best.
But even amid all the heartbreak, there are heartwarming stories of survival. A tearful send-off for Christina Paz, a mother of 5 who left the ICU and got to hug her husband today for the first time in 2 weeks.
Tonight here in California, the governor says there may be no sense of normalcy anytime soon, saying social distancing could be extended in this state into June. Lester?
All right, Miguel, thanks very much. And now to the stunning shakeup. The acting Navy secretary out after he harshly criticized the fired captain who made a desperate plea for help after the coronavirus outbreak on his ship. Kristen Welker is at the White House.
Tonight, a dramatic twist. Acting Navy Secretary Thomas Modly has resigned after setting off a firestorm with a profanity-laced address Monday, attacking the captain he ousted, Brett Crozier, in remarks to the crew of Crozier's former ship, the USS Roosevelt. Modly dismissed Crozier last week after Crozier wrote a letter that leaked to the press sounding the alarm about an outbreak of coronavirus on his ship and pleading for help. On a recording obtained by NBC News, Modly accused Crozier of a betrayal of trust.
If he didn't think that information was going to get out into the public, then he was A, too naive or too stupid to be the commanding officer of a ship like this.
Some of the sailors with a strong reaction of their own. Crozier, who has now tested positive for COVID-19 himself, was given a hero's farewell when he departed.
Captain Crozier!
President Trump reacting late today.
He didn't have to resign, but he felt it would be better for the country.
It all comes as the president's entire response to the coronavirus is under new scrutiny amid revelations one of his closest advisors, Peter Navarro, warned the White House on January 29th in a memo obtained by the New York Times and not confirmed by NBC News. The coronavirus could cost the United States trillions of dollars and millions of lives, warning of a lack of preparation that, quote, elevates the risk of the coronavirus evolving into a full-blown pandemic, imperiling the lives of millions of Americans. Around the same time, the president repeatedly downplayed the threat.
I mean, view this the same as the flu. We're in great shape, though.
But now he repeatedly says this.
Nobody could have predicted something like this.
Tonight, Mr. Trump responding.
But I heard he wrote some memos talking about pandemic. I didn't see him. I didn't look for him either. But that was about the same time as I felt that we should do it. That was about the same time that I closed it down.
Now, that is a reference to the travel restrictions against China. Meanwhile, the president has replaced the acting Pentagon inspector general from overseeing the government's handling of that $2 trillion stimulus package. Top Democrats condemned the move, calling it corrupt. Lester.
All right, Kristen Welker at the White House, thanks. And for millions of small business owners, the frustration and fear are only growing as they try to navigate the federal loan process and wait for the money to arrive, money they desperately need. With more on that, here's Stephanie Rule.
The clock is ticking for small business owners.
As each day goes by, we worry more and more.
Days of frustration and confusion.
Every bank is on a different page.
After the chaotic rollout of the government's $350 billion Paycheck Protection Program, despite continued reassurances from the Treasury Department.
You get the money, you'll get it the same day. If you don't get the loan this week, there'll be plenty of money for you next week.
Of the 4 biggest banks, 3 received loan applications for more than $90 billion. But so far, they've distributed little to no money. Wells Fargo stopped accepting applications 48 hours after it started. And as of today, Citibank's online application process hadn't yet gone live. The Treasury Department says $75 billion in guaranteed loans were processed, some through community banks. But it's unclear how much has gotten into the hands of business owners like Wendy Bourne.
50% of restaurants might not even make it. I might not make it.
Bourne closed her 3 Metropolitan Bakery locations in Philadelphia.
We need the PPP to enable us to resume operations, rehire our staffs, pay our bills. It's extremely urgent.
After a week of gathering documents, Bourne was finally able to submit her application. She's been waiting 4 days to hear if she's been approved. Alex Perry, who owns a commercial sign company, has been waiting even longer.
We're down about 80%.
Perry applied through a community bank in Illinois and can't get an update on its status.
All the lenders and all of our vendors are playing nice right now. We're all in this together. But I worry what's going to happen 4 to 6 weeks when their bills come due.
Lester, today the president said he wants Congress to come up with an additional $250 billion for the program and wants the Senate to vote on it as early as Thursday.
All right, Stephanie, thank you. Please join me for a special hour-long report on the pandemic. We'll answer your questions tonight at 10 Eastern on NBC and msnbc. And we'll be back here in 60 seconds with the first images of life resuming after the lockdown at the original epicenter of all this and the new test that may hold the key to getting people back to work in this country. As the coronavirus spreads in the U.S., China today lifted the lockdown in Wuhan, where the virus first emerged, while in the U.K., Prime Minister Boris Johnson remains in the ICU. NBC's Richard Engel reports.
Where it all began, in Wuhan, China. Today, the government lifted its quarantines after more than 10 weeks of complete lockdown. I haven't had noodles for 2 months, said this woman. They taste even better. But authorities closely track residents using an app. Although there are accusations China has been fudging the numbers, it reported for the first time no new virus deaths. Hardly so in Europe, where thousands are dying every day, with no one exempt from infection. British Prime Minister Boris Johnson remains in an ICU. Downing Street saying he's stable, in good spirits, breathing on his own. Johnson has handed over control to his foreign secretary. The government says whenever necessary.
I can reassure the Prime Minister, and we can reassure the public,
that his team will not blink and we will not flinch from the task at hand at this crucial moment.
I spoke to Johnson's former press secretary.
He's guided in many ways by what he used to do on the rugby field. No matter how hard you are hit, you dust yourself off, you catch your breath, you get on your feet, and you get on with the task.
Johnson is spending another night in the ICU here as the UK recorded its highest daily death toll so far, around 800. And experts say the peak has yet to come. Lester?
All right. Richard Engel in London tonight. Thanks. And back home, a major push to speed up testing for coronavirus antibodies. Tom Costello now on why it could be the key to getting Americans back to work.
It could be a game changer to protect frontline paramedics, doctors, and nurses, and maybe reopen the economy. A simple finger prick blood test to determine whether someone has already been exposed to the coronavirus with or without symptoms, recovered, and now has the antibodies.
That would mean that you're no longer contagious and you can't catch the virus because you have the antibodies in your system, which means you can get to work, you can go back to school, you can do whatever you want.
Already, New York State is ramping up production of the test kits. Similar efforts underway at Stanford University and North Carolina. The results available in minutes.
And we're hoping that that will ultimately give more insights for the health departments of how it's being spread and what the true presence of COVID-19 is in the population.
The FDA has given emergency approval for a test with widespread testing as soon as May.
We can test people to see if they've been exposed, immune, and go back to work. And a combination of that kind of test with the current kind of test we have now is how America opens back up.
But testing isn't always successful. The UK ordered 4 million antibody test kits and found them to be unreliable. Germany is considering issuing work permits to people who test positive for the antibodies, but that could be months away. Importantly, the antibody test is not the same as the test to determine if you currently have the virus.
But as we're working on the crisis of today, we're looking to the future to ensure we have the systems in place to bring those early alert systems together while we work on the antibody testing.
Most researchers agree with Governor Cuomo that it's unlikely you'd get the virus again if you have the antibodies, though they need hard science to prove that. Lester?
All right, Tom, thank you very much. Coming up, Senator Amy Klobuchar and her husband's urgent message following his coronavirus battle. All right, we're back now with Senator Amy Klobuchar and her husband, John Bessler, speaking out exclusively to our Stephanie Gosk following his coronavirus fight.
For Senator Amy Klobuchar and her husband, 2020 started off crisscrossing the country. But days after she dropped out of the presidential race, the couple would be facing a very different kind of challenge, coronavirus.
It just suddenly hit me. I had a fever. And that fever just lasted for days and days.
And I kept saying, it's over 100, like every day. It's still over 100. I think you might have this.
Senator, you don't strike me as an alarmist, having watched you on the campaign trail. But was there a point when you started to get nervous?
Yeah, well, when he seemed not always attuned to what that temperature was and that it was so high, when he started coughing up blood, when you detected the shortness of breath, in our phone conversations.
John had to go to the hospital for 5 days, relying on supplemental oxygen.
It's so hard, and he ended up taking a turn for the better. So many people take a turn for the worse, and you can't be there. You can't hold their hand. You can't give a hug to the health workers.
John, you're 52 years old. You had no underlying health conditions. You're the person this is not supposed to affect like this, right?
Yeah, I mean, this is not a cold. You don't get pneumonia when you get a cold, and you don't end up at the hospital on oxygen when you get a cold. This is really a serious thing.
Now he plans to donate plasma.
As I still have some pneumonia from the coronavirus, so I'm still dealing with that. But as soon as I get over that, I'm going to be donating some blood.
But he's not contagious anymore.
No.
At least that's what the doctors say.
Tonight, the family is back together. Their daughter made them spaghetti.
We can send him out to the grocery store now. That's his job.
Stephanie Gosk, NBC News, New York.
A battle so many are fighting. Up next for us, the new portrait of American families on the front porch. Finally, let us show you the new twist on the family photo. Here's Kevin Tibbles.
Portraits of families together in a pandemic.
Hopefully they're going to remember this time as the day they could take a picture together, because something bad happened, so that's the good thing out of this. Okay, you ready?
Jackie Bravo Visser is one of many photographers, snapping parents, kids, and pets from the safe confines of their porch, often stopping on walks to shoot folks in Chicago she's never met, free of charge.
It's a gift, really.
Like Fran, Izzy, and Eric Abramovitz.
Kindness and hope, and that we're going to be okay.
Chris Villa was supposed to be on vacation in Florida. So what does the photo do for you?
It just brings back a memory that we were doing the best that we could in these times.
Ready?
Keepsakes of when we all made the best of it.
1, 2, 3, cheers!
Kevin Tibbles, NBC News, Chicago.
Picture that. That's Nightly News. I'm Lester Holt. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.